I'm Steve Leach, and I'm currently the David Rubenstein Chair and Director of the Rubenstein Center for Pancreatic Cancer Research at Memorial Sloan Kettering. As of September 1st, I'm going to become the Preston and Virginia Kelsey Distinguished Chair in Cancer and Director of Dartmouth's Norris Cotton Comprehensive Cancer Center. I think the Turncoat Purple very effectively crystallizes the sense of urgency that we all need to feel when we think about pancreatic cancer patients and the urgent problem that they're facing, and more globally, the urgent public health problem that our country's facing as pancreatic cancer rises to become the second leading cause of all cancer deaths. Well, all of the great accomplishments in civilization have been accomplished through public-private partnership, arguably, and that's urgently what we need in pancreatic cancer. The problem is that the federal outlay of research dollars to support research in pancreatic cancer doesn't match that sense of urgency and emergency. Fortunately, we have more than two, but the two large foundations that through private philanthropy very generously support pancreatic cancer research. And that's the Lustgarten Foundation and the Pancreatic Cancer Action Network. And there are a number of other important foundations as well, the Hirschberg Foundation, the National Pancreas Foundation. And so it can be said that the private sector is doing its fair share of the lift here. We'd always welcome more philanthropic support, but the private sector is doing its fair share of the lift in terms of funding for pancreatic cancer. These foundations provide tens of millions of dollars each year in funding for pancreatic cancer research. And in contrast, the entire federal outlay for pancreatic cancer research is something like $125 million a year. And to put that into context, it's been estimated that it may take $2 billion to bring a new drug to market. It may take $100 million to bring a new medical device to market. But unfortunately, funding through the NCI tends to favor a bit more cautious, perhaps lower risk, but then lower yield type lower impact research studies, where we have the urgent need for bold research, risky research, outside the box kind of research to push forward our knowledge about pancreatic cancer and develop effective therapies. And that kind of research is less commonly funded through current grant application and proposal mechanisms. And so while we would also clearly favor a global increase in the government outlay for pancreatic cancer research, we would also favor more willingness to fund creative outside-the-box proposals. And the National Cancer Institute has a number of initiatives. It's Bold Questions initiatives that are kind of moving in that direction, but it's been a bit incremental and perhaps could be pursued even more aggressively. Code Purple, demand a new approach.